I now recognize Mr. Perry from Pennsylvania.
Thank you, Mr. Chairman. Thank you, Dr. Cahill. I want to talk to you about the World Health Organization and the...
I'm sorry, my name is called all kind of things. It's
Caliph, sorry, I'm sorry.
I've gotten a lot of different pronunciations here, but I'm used to that.
That wasn't an incorrect pronunciation. That was just plain damn wrong. But I want to talk to you about this treaty. I think 185, maybe plus nations, including places like Yemen, Iran, Iraq, Afghanistan, Cuba, Haiti, and some terms in that. We haven't seen it. We haven't seen the 30-plus amendments, so we're kind of shooting in the dark here, and I don't know that you know any more than any of the rest of it than we do, but there was another draft just last month that created a multilateral system for sharing pathogens with pandemic potential. I already listed some of the countries involved. It also commits each party, which would include us if we were signatories, to promote timely access to credible and evidence-based information on pandemics. And the aim there, I guess, is to combat misinformation and disinformation, I guess, as you see it or as they see it. So my question is, with the potential threat to U.S. sovereignty for decision-making on whether a pandemic even exists and the prescribed remedies, including lockdowns and maybe even medicating, would you commit before the committee today to pledge not to adopt policies included or pursuant to the treaty until such time, and if such time, as that treaty would be ratified by the United States Senate?
I'm not sure how to answer that question given the complexity of what you said, but it's hard for me to imagine that we would do something at FDA that's not a government policy. Now, you referred to the Senate in particular. I'm just not familiar enough.
Well, if the Senate doesn't ratify it, it wouldn't be a treaty that we would be signatories to, or at least not legally. And I just want to know if there's any intention on the FDA's part to institute any of the provisions within the treaty without the proper ratification from the United States Senate.
I don't think that particular issue would fall within our purview, and I don't know enough about it to make a commitment. I will comment that
sure,
we, if we just look at the avian flu situation we're in now, the knowledge of the molecular structure of whatever the pathogen is turns out to be really, really critical to come up with countermeasures to treat it. And so I hope we can work out a way. And also, even for food safety, we've talked about the imported food that we get. The genetic composition of the pathogen turns out to be really important. So I sure get what you're saying. We got to do this carefully, whatever we do. But I hope there will be a way that, for example, we don't get exposed to a new pandemic where we know nothing about the organism until it's too late.
And we also, I think, most people in America want to maintain their medical sovereignty, the individual medical sovereignty that we all enjoy. Regarding censorship, the CDC was involved in media companies taking down social media posts regarding misinformation and disinformation, again, terms that I think are loosely defined, but the FDA has been involved in this process in the past, having awarded several grants in the range of hundreds of thousands of dollars to places like the University of Maryland at College Park, Texas Women's University, regarding, again, misinformation and disinformation. Commissioner Caliph, has the FDA coerced social media companies to take down users' social media posts regarding the pandemic or any other topic due to what they describe as mis- or disinformation? Not at all to your...
Not to my knowledge.
So would you consider, if the FDA is granting organizations like the University of Maryland or Texas Women's University to mitigate the spread of misinformation or disinformation, that's essentially subcontracting out that duty? You're saying the FDA hasn't done it particularly, but have they done it indirectly through their surrogates or their subcontractors via the grant program?
I'm not aware of the particular contract you're talking about, but let's remember that throughout the history of the FDA considers data and information, makes a decision about a product, puts together the risks and benefits into a judgment as to whether it should go on the market. It's put in the label. The label is then transmitted to clinicians all over the country who then work with their patients to make decisions about what to do. The sovereignty that you refer to is typically a patient-doctor relationship based on that information. Places like University of Maryland has a major first-rate medical center. They're intermediaries in this process of relaying useful information. Now, if someone is saying something that's flat out wrong, you know, how that's dealt with by University of Maryland, that's their business.
But it also has the imprimatur of your approval, and when they found out to have been wrong in the past for coercing social media companies to take down so-called posts that then were later found to be incorrectly done, where is the remedy? And is there an apology from the FDA? Is there an admonishment from the FDA to these universities that have been fast on the trigger and coerced and changed the narrative or changed behavior based on things that aren't true?
Far be it from me to apologize for a university. I'm a longtime university person before coming to FDA, but I think what the university does is the university's business.
Well, understand, it also is a reflection on the FDA. Mr. Chairman, I yield.